Namaste. Welcome you all for the session on pelvic health. This is the sixth in the series. So today we will look at especially some of the variations in Upavishta Konasana and how they help the pelvis. So we will begin with the basics. Lie on your back, fold both legs, heels closer to the hips. Watch your breathing. Keep a blanket below the neck. Keep the neck at the center, chin slightly towards the chest. Right palm on the abdomen, right palm on the chest, just to get the feedback, biofeedback about your breathing. Right palm should move up and down as we inhale and exhale. Left palm should remain stable, which means chest should not move too much. It's only the abdominal cavity. As you inhale, the bottommost portion of the abdomen, that is the pelvis, and then the middle of the abdomen, then the top of the abdomen should expand all around. And you must feel it. You must feel the top of the abdomen, the sides, the bottom, where the lower back muscles also respond to breathing. Slowly inhale. This is a very, very important step. Don't neglect. Most important breathing. You have to slowly inhale. Allow the pelvis and the abdomen to expand. Then simply relax. Abdomen and then the pelvis contracts as you exhale. Make the inhalation exhalation slower so that you breathe about 78 cycles per minute, which is fairly easier. Most can do that. Then the next important thing, make the exhalation little longer than the inhalation. Then watch the transition between inhalation, exhalation, exhalation, inhalation. There's a smooth transition that you should watch. So this breathing imparts a very good deeper relaxation. So learn to maintain this breathing. Stretch both arms up. Rise your right leg up. Pull the kneecap, stretch the heel, toes towards the knee, tighten the kneecap, tighten the quadriceps, front of the thigh. Feel the stretch in the back of the thigh at the calf muscle. Down. Left leg up. Pull the kneecap, stretch the heel, press the right foot and tighten the back of the right thigh also, don't forget. And do not allow the sacrum, that is the segment of the spinal column just below the lower back, to take off from the mat. You have to flatten it towards the floor. Down. Right leg again. Pull the kneecap, stretch the toes towards the knee. Down. Left leg. Down. The next one, right leg up. Fold. From right hand, from both hands, hold the knee and press the knee closer to the chest. Stretch the toes towards the knee. Tighten the back of both the thighs. Right leg down. Chain. Left leg. Fold, hold the knee. Pull the knee closer to the trunk. Watch your breathing. Breathe against the pressure of the thigh. Down. Right leg. Down. Chain. Left leg up. Fold, hold the knee. Press the knee closer to the chest. down. The next one, right leg up, fold it across in Padmasana, taking the right heel as close to the root of the left thigh as possible. Stretch the toes up, push the knee. Watch your breathing, feel your pelvis. Down. Chain, left leg up, fold Padmasana, push the knee, tighten the back of both the thighs, feel the region of the sacrum. Release. Left leg. One more time, right leg up. Fold it across. Down. Chain, left leg, fold it across. Down. The next one, right leg up, fold from left hand, hold the ankle joint, pull it from right hand, push the knee across the chest. It's a good stretch for the gluteal maximus muscle. Again, ensure that you push the sacrum. Sacrum means that flat bony segment of the spinal column just below your lower back. Down. Left leg up, fold, hold the ankle joint, pull and press the knee across the chest, ensuring that you are flattening the sacrum against the mat. Stretch the left foot upwards. Down. One more time, right leg up, fold, hold the ankle joint, pull and then press the knee. Watch your breathing. down, chain, left leg up, fold from right hand, hold the ankle joint, pull from left hand, push the knee, release left leg. Now take the dupatta. We will do that side stretch. Dupatta, even if you have belt also okay, but dupatta would be good enough. Raise the right leg foot up. Put the dupatta to the edge of the right foot. Edge means to the base of the toes. Then right leg straight. Pull the kneecap, pull the foot down so that the dorsiflexion improves and you can feel a better stretch in the calf muscle and the hamstrings. Hold both edges from the right hand on the left base of the thigh, then slowly take your right leg straight to the right side. Hold the kneecap. You have to push against the dupatta so that you experience a better stretch, and flatten the sacrum towards the mat. Press the left foot, activate the back of the left thigh. Feel your pelvis. Slowly bring the right leg up, down. Chain. Dupatta to the front of the foot. Left leg straight. Hold both edges from your left hand, right hand on the right root of the thigh. Slowly move your left leg to the left side. Press the left elbow on the floor. Straighten the left leg. Feel your breathing. Especially as you inhale and exhale, develop a feel for the boundaries of your pelvis. Bring your left leg up. Hold the dupatta from both hands and get the left leg down. Now slowly get up from the right side. Sit upright. We'll do the posture Ardha Hanumanasana, which is a good mobilizer for the hip as well as the pelvis, because this is a unique movement which combines the flexion of one hip with the extension of the other hip. So sit in Chatushpadasana, palm below the shoulders, knee below the hips. Breathe at ease. Now take your right foot forward between the palms and then sit. You can keep your fingertips on the floor, sit, and then take both hands on the waistline. Stretch your left leg properly in line. Chest and navel up, chest to the center, chest up. Lower the right hip as much as possible. So right hip is in flexion, left hip is in extension. Right knee is in flexion. Left knee is neutral. Right foot is in dorsiflexion. Left foot is in plantar flexion. And now watch your pelvis as you inhale and exhale, and stretch both arms up. Keep on stretching the arms and look up. As you look up, try to lower the right hip all the more down. Feel a good stretch in the left groin. Take your both hands down. As right leg back. You can be on your fingertips. Now change. Left foot forward. Stretch the right leg. Both hands on the waistline. Activate the right calf muscle and buttocks. Lower the left hip, then stretch both arms up. Watch your breathing. Bring both hands down. Take your left leg back. Then sit upright. Now fold the blanket like this. We need 2 blankets or a bolster if you have one, so that you get a height of about 3 inches. So sit upright on the blanket. hips on the blanket and foot on the mat or floor. So sitting at a height gives you better access to your pelvis. Because as you know, the pelvis has an inherent forward tilt like this. So if you sit on the floor and if you cannot straighten the back, then there will be a lot of strain on the pelvis because natural tilt will be lost. Whereas here, if you sit at a height, you are maintaining that natural tilt comfortably while you can also straighten the back. Watch your breathing. So we'll do the twisting. Left hand on right knee, right hand fingertips on the floor, inhale, exhale, turn. Inhale, pelvis and abdomen should expand. Exhale, they should contract. Slowly come to the center. Change. Right hand on left knee, left hand fingertips on the floor, inhale, exhale, turn. Slowly come to the center. Now we'll do Bharadvajasana. Fold both legs to your left side, taking the foot to your left side, knee and thigh pointing forward. Sit upright. Hips on the blanket, legs down. Left hand on right knee, right hand fingertips on the floor, inhale, exhale, turn. Watch your breathing. Get into the pelvis. You should flow through the abdomen and pelvis using your breathing. Slowly come up, change. So remember, pelvis is a good bony structure which houses the urogenital organs, the urinary bladder and our two excretory organs, the reproductive organs, and of course in women uterus also, ovaries. In men it is prostrate glands. So all of them need good supply of blood and oxygen, and the muscles around them should also be strong enough to hold them in place. Now change, right hand on left knee, left hand fingertips on the floor, inhale, exhale. Slowly come to the center, sit in Swastikasana, sit upright. Most of the movements essentially involve the lumbo-pelvic hip complex. Whether you are doing backward bends, forward bends, standing postures, invariably this is what you call as the LPH complex is involved. But in this series we are emphasizing pelvis and trying to indicate few postures which help to mobilize this region, also relax this region. Now we are going to do Upavishta Konasana. You have to spread the legs to the sides. Keeping the legs straight is important, not how much angle you take it apart. So don't overstretch. So legs apart as much as possible. Do never overstretch in Upavishta Konasana because groin is there. And that is a sensitive area. Groin tears are not very uncommon. That is one of the leading sites of injury. So be careful. But keep the legs straight, align the thigh, knee, calf and the foot, toes towards the knee, and sit upright. Notice that because of this, your hips are at a height, you can easily sit upright. Otherwise, there is some amount of effort involved which a beginner may not be able to do. Watch your breathing. Pull the kneecap, toes towards the knee. especially as you inhale, and particularly in this posture, you can reach all the boundaries of your pelvis. Keep the legs straight. Watch your breathing. So you can, as you inhale, feel the bottommost portion, that is the lower pelvis. In the lower diaphragm in the pelvis. At the sides you can feel the hip bones. Front you can feel the pubic bone. Back you can feel the sacrum. That is the segment of the spinal column which articulates with your hip. Making the breathing deeper and slower, very important, because when you breathe deep, the diaphragm would move to the full range, and movement of diaphragm gives a good massaging effect for your abdominal and pelvis. The organs contained there will get a greater massaging effect. That's why it is very, very important. Now we will try a forward bending posture in this. Keep the chest and navel up and bend forward. Stretch the trunk. Slowly lower the head. If possible, rest the head on the floor and stretch both arms. Else you can keep some support for your forehead. Including a chair if you cannot really bend too much forward. But when you do bend forward, you can feel a better stretch in the groin. It gives a better opening for your pelvis. Keep the legs straight. Press the palm and slowly get up. Right, join the legs, come to Swastikasana. Just be relaxed. Watch your pelvis. And in Upashta Konasana, don't try to push it too hard. And especially asking someone to push the foot. So that is when you spread like this, if you ask somebody to push here, then you can see the force into distance. Distance is large. Force into distance, the moment caused here will be quite significant, and it could lead to tear of the groin. So this is very, very precarious situation. Most common injuries in yogic practice. Be safe. So that how much you can spread depends upon one's own flexibility. Don't try to overstretch. It has to gradually happen. Let it take its time. We'll do one more time. Upashta Konasana. You have to gently spread the legs apart. Be seated at a height, but sit upright. See, the fundamental principles, you should keep the legs well aligned, trunk upright, so that your pelvis gets benefited. Now we just do a simple twisting of the trunk in this. You have to keep the left hand fingertips in front, right hand fingertips at the back, inhale, exhale, turn. Keep both legs straight. Watch your breathing. Slowly come to the center and then chain. Right hand fingertips in front, left hand fingertips at the back, turn. Slowly come to the center, legs straight. We shall do twisting one more time. This time, right hand back, from left hand, hold the right thigh and turn, but legs straight. Slowly come to the center and then change. Left hand at the back from right hand. Hold the left thigh and turn. Slowly come to the center. Join both legs and just sit in Swastikasana. Sit upright. Feel your pelvis. Now sit in Baddha Konasana. This is another very useful posture. And please remember, even here, putting too much of load on the knee. A self-load is okay. External load like somebody pushing hard here or standing on the knees, and especially with over enthusiasm of pushing the knee, if people stand here and press, this is the region, the groin, that can snap. So be careful when you practice these postures. Using self-load is okay because that feedback mechanism manages the loading properly. Sit upright. Gently close your eyes. Slowly inhale, allow the pelvis and abdomen to expand, and as you exhale, abdomen and then the pelvis should contract. Watch the movement of the diaphragm, the upper diaphragm, which divides the chest from the abdomen. So that moves down as you inhale, moves into the chest as you exhale. When it moves down, it presses on the abdominal viscera and therefore you feel that expansion inside the pelvis and abdomen. And it relaxes into the chest, allowing the abdomen and pelvis to contract. Now we are going to do the practice of Bhastrika. The procedure is you have to push the diaphragm down, inhale quickly, forcefully, then contract the abdominal muscles, expel the breath quickly, forcefully. If you find it difficult to do in Baddha Konasana, you can sit in Swastikasana and do it. The reason for doing in Baddha Konasana is that you have a better and more freer access to your pelvis in Baddha Konasana. So procedure is you have to push the diaphragm, contract the diaphragm down, push it, inhale quickly, forcefully, contract the abdomen, expel the breath quickly, forcefully. Don't use too much of force. And of course, you should remember all other precautions which we have often emphasized in our earlier programs. And let us do only for 30 cycles. Start now. Be relaxed. As soon as you stop this forced breathing, you can feel the state of Kevala Kumbhaka, where there is neither inhalation, exhalation nor retention of the breath for a few seconds. You can come back to Swastikasana if you wish, and then again sit in Baddha Konasana. I would suggest that just relax the thigh. Okay, let me also do that, just to avoid that feel of overstretch. If you are comfortable, Baddha Konasana again. We shall repeat Bhastrika 30 cycles and especially feel your pelvis. Forced inhalation, forced exhalation. 30 cycles. Be relaxed. This forced breathing, don't do too many repetitions. Again, breathe abdominally. Now we are going to do the Kapalabhati. You have to contract the abdominal muscles, expel the breath quickly, forcefully, relax the muscles, the air automatically enters in. I repeat, you have to contract the abdominal muscles with a gentle force, expel the breath quickly, forcefully, relax the muscles, the air automatically enters in. 30 cycles, gentle force, not too speedy. Be relaxed. Feel the deeper calmness. Sit in Swastikasana. Salutation to Sage Patanjali. Take a deep breath. Yogena jittasya padena vacham Malam sharirasya cha vaidyakena yopakarotam pravaram muninam patanjalim pranjaliranatosmi Hari Om. Shri Krishnarpanamastu. Shri Gurubhyo Namaha. Shubhamastu.